Any change has got to consider the current reality, how our structures currently are, what arrangements are in place, the public-private mix, what should that be, how we finance healthcare, the role of private health insurance, how we pay for services, the under-resourcing of prevention, priority-driven research, the list goes on. But at the end of the day, the system needs to work for all consumers.
I want us to talk about the outcome for people and work out how all the different bits of the system can deliver that. The sorts of success in areas where there's been big reforms, you've had all the different stakeholders wanting the same thing. So, you use the tobacco control. That was relatively simple in a way because everyone agrees about the harms of tobacco and all sorts of unusual partners agreed to do it. I think we need to build the platform for what are the things that these unusual partnerships all want, because governments, they can't make it happen if there isn't enough agreement amongst these very difficult stakeholders that we're all part of. And so I think whilst you can't achieve the big picture instantly, we need a bit of thought about what the big picture outcome is so that we put aside then some of the other things we want to really deliver change.
How can you have the pyramid of a healthcare system where the GPs feel, and the rest of primary care feels like they're the third cousin? There's vast disparities in how they're paid, how they're used in the system. To me, that's a bit that we should get right, instead of building $2 billion edifices all over the place.
And how? What would be your map to making that better than it is now? What would be the incentives or otherwise that you put in the system?
Yes, money comes into it, but I don't know how the $32 billion of Medicare money gets split up between primary care and specialist and diagnostic, but that's the level of debate I would expect. How GPs use other parts of the primary care system, the workforce, the skills they can get from specialists. We have all the smart specialists in the hospital. Why the hell do we have all those skills there when they can be out improving the skills of people in the community?
Dwayne, do you think we've got a universal healthcare system in Australia?
Well, yes, we have, even though I think Australia finished very low on the equity component of the Commonwealth Fund survey. I think it kind of depends what's relative, but yes. I think the real problem is universal access. What does that mean to the average person who's on a 4-year waiting list for something that's pretty common, say, in Queensland? Because that's kind of the feedback I get. The waiting times for some things are so unreasonable, you could kind of debate what access really means.
I would like to see an environment where there was far more incentive to innovate than exists today, and I'll just give you one example. In 2000, I reckon we led the world in health IT. Today, in 2017, health IT is an absolute unmitigated disgrace in Australia. For Christ's sake, we still don't have a functioning e-health record.
No, but I think one of the worries is that because of the way our system works, and because it doesn't satisfy a lot of people, the disruptors could actually be completely outside the health professions. But I think the way the medical professionals guard so tightly, everybody guards so tightly their territory, it's even more worrying that they might skip out of the well-qualified health professionals that are not doctors into the, shonks and quacks who are crazy.
But hold on.
We already spend a huge amount of money on non-proven, pills and vitamins and whatever for a whole range of things so that's the worry. The disruptor could actually be much more damaging than a more modest disruption, which would require people to give up a bit of their territory.
But
I think the health funds could be the disruptors if they are allowed to, but they're not allowed to at the moment, and they're not rewarded for being disruptors because we have a thing called the reinsurance pool that about 50 people in Australia understand.
We're run out of time. Can you please join me in thanking our fantastic panel?
It seemed to me that what kept recurring was the desirability of perhaps focusing on the patient or the customer rather than focusing on systems and any of the individual parts of the whole setup. Thank you for coming today, and Norman, thank you very much.